what I would say though, as a country, we need to mandate that orders and results, as a minimum, orders and results have to be harmonized to national standards. At Catalyst, we built Touchstone, which was this national repository of EHR data. And depending on how you slice the data, at most 20% of lab results are harmonized to LOINC. So 80% of our lab results have no associated LOINC code with them. And for medications, it's even lower. It's less than 1% harmonized to RX norm. And the analogy that I use for that is, imagine if you went to the grocery store or to Target or to Walmart or whatever else, and 1 out of 10, maybe 1 out of 50 products had a UPC code on it. What would be the implications to the consumer experience? What would be the implications to the supply chain, to the manufacturer, if retail products didn't have UPC codes on them? So UPC codes are to retail what standard terms are in healthcare, and we have not embraced it, and it's ridiculous that we don't. It should be a mandated law. Every lab order, every lab result, every medication order, every medication prescription should be associated with national and international standards. And that's something that has zero impact on the clinician experience, by the way. That all happens in the background when you set up your orderables catalog. And the only reason that we're harmonizing to anything right now is if it's associated with reimbursement. That's why the numbers are so low.
Yeah. So if you're sitting in the CIO chair, I just hired you to be my CIO for the health system. What are you doing to get ahead of this? There's some basic blocking and tackling that is pretty easy to get done.
Well, fundamentally, when you deploy your EHR, we should have all built orderable catalogs that were harmonized to national standards. All right. Very few, if any, organizations did that. Now we've got to go back and retrofit them. So I would kick off an initiative and say, look, we're going to lead the way with this, and we're going to chip away so that every one of our orderables has a national standard term associated with it. Even if it doesn't have anything to do with reimbursement, everything we order is going to have a UPC code associated with it. And by the way, I'll comment on this too, Bill. Going back to the military for a second, I was weaned from military commanders who insisted on data quality. All right. It wasn't a nice to have. It was like, God damn it, Lieutenant, make sure this data is accurate and don't come back until it is. And by the way, if we need to build more satellites and sensors to make this data better, then let's go kick off a procurement to do that. So there's an insistence at the leadership level of the military around data and data quality and data analysis that does not exist in our healthcare executive culture now. It's that kind of insistence around being informed for decision-making that's missing in the leadership of healthcare right now. And I don't think healthcare executives ever really get exposed to how poor the data quality is that they think is high quality, and the decisions that they make are so off base.